Hey guys, in this video I will be covering Omda Health Group, which is a leading Nordic healthcare IT company delivering advanced software solutions for medical imaging, emergency care, maternity and health analytics, helping hospitals improve patient outcomes through seamless data integration and secure workflows. In this video I will be covering Omda's financials and some of their products. This is not to be considered financial advice. Omda is listed on the Oslo Stock Exchange. They have 289 full-time equivalents, so that's employees on the first quarter. Most of them are in the Nordics, some are in other regions as well. These are numbers from the 2025 Q1 results. So they had 121 million Nordic crowns of revenue and 27 million crowns of earnings, so that's a 22% margin. I also checked the 2024 revenue numbers, that was 429 million Norwegian crowns, so that's roughly 36.8 million euros. If you divide that by the 289 employees, that's a quite healthy 127,000 euros per employee of revenue. On the Q1 results, they also say that they are on a trajectory to 1 billion Norwegian crowns by the end of 2025. So I think that's quite impressive growth if they really achieve that. They also state that the distribution of sales is 51% from Sweden, 20% from Norway and 14 from the rest of the world, and Denmark and Finland is also mentioned. They had 600 contracts across 27 countries, so that's quite nice. And the recurring revenue is 77%, license sales only 3%. So a lot of the sale revenue is coming from existing contracts. I'm just wondering, does the small number of license sales mean that they are not winning new business, or is the revenue model different than license sales? They also mentioned the distribution of sales per business area. So emergency is the biggest at 45%, connected imaging is 18%, laboratory information management systems is 15%, and the others are also mentioned there, but they are quite a bit smaller. I'm also going to cover some of the history because they have an interesting growth story through acquisitions, and it all seemed to begin from Norway. They had this hospital where they created this clinical portal, and they called the framework CSAM, Clinical Systems All Managed. And in 24 or 25, they spun that out as a company called CSAM, and now they are known as Omda because they have rebranded. Their focus was on strategically consolidate niche software, and they did some acquisitions. For example, Linsoft is mentioned here, and in 14 or 15 they acquired Amis for emergency healthcare, so that's, I think, the foundation for the largest business area they are currently in. In the history, we also see they are mentioning the acquisition of a Finnish company called Mavelle, and also other Nordic companies, and they also listed in the Euronext Growth Stock Exchange in 2020, and then later, was that 22 or 23, when they rebranded to Omda. I also asked ChachiPT to list, based on the press releases, some of the acquisitions. Amis was already mentioned, that was a Norwegian company, acute medicine and emergency software. Then 2016 they acquired Mavelle eSystems from Finland, and that had the Medimaker IP, and also another one, MediWare from Finland, maternity software. And 2019 they acquired Kibi, a Norwegian company. I think they had the headquarters in Stockholm, Sweden. That's mentions that they are in cloud-based vendor-neutral archiving, but I think, for example, the Electrocardiogram software came from the Kibi acquisition. And then 21, they have done a acquisitions, Carmenta and Optima, MediMaker AB, many of them related to the emergency response part, which they have been strengthening through these acquisitions. Then 22, Carmona AB, Unified Patient Data and Health Analytics. Next, let's have a look at their products. Let's start with the solutions page, where they list the different solution areas they have. So let's start with the emergency area, because that's the one which they have the highest revenue from. So they have something called Omda Readiness. So this seems to be listed as a simulation software and resource planning, real-time resource management. Then Omda Incident, they have real-time text, speech-to-text functionality, and e-calls and stuff like that. Dispatch support, quite comprehensive. Omda Response, that's for electronic medical records. I think that's the system for the ambulances. Omda Performance, so this is something related to reporting. And this I find a bit confusing, that they list these kind of Omda Readiness, these kind of terms up here, but then on the bottom of the page they actually list I think these are then the product names. For example, Omda Amis, this we recognize from the acquisitions earlier. I think this might be the actual product name here, where they describe then further the product, what it is capable of. For example, this Omda Paratus seems to be software which you can run on one of these tablet computers and do some EMR type logging and recording that software. The second largest area is connected imaging with 18% revenue, and here they kind of approach the thing similarly as on the emergency care side. They call this Omda Media Lab, Radiology, Electrocardiogram, Omda Health Connect, Omda Archive, Omda Mavelle, and on the bottom of the page they then seem to have product profiles. So for example, as it's Omda Cardio, which is the electrocardiogram solution. It's a bit confusing to know what is what, and reading through many of these Omda Media Lab, for example, it's a bit hard to understand what this actually is based on just some of these words. And okay, Omda Radiology, that's maybe a bit more clear. User-friendly radiology information system, so that's a RIS system. But then, of course, like, what are the actual capabilities of this? You don't get a proper understanding from this information here. Omda Electrocardiogram, they again describe it very briefly. I believe they also have an electrocardiogram viewer. They don't really show that here. Omda Health Connect, Omda Archive, it's a bit confusing what they actually mean. So I find these product profiles a lot more informative here at the bottom. For example, Omda XDS, they describe this as an XDS registry and XDS repository. So those are the IHE Integrating Healthcare Enterprise. Well, they are not standards, they are profiles describing the functionality what a registry and repository have. So the repository stores the binary data and XDS registry stores the metadata. They have also an XDS consumer, so that would be some kind of a viewer, and an XDS source, which is capable of storing content into the repository. So this is quite a bit easier to understand, at least for me, since I'm familiar with the IHE XDS profiles. So they wrap this into an Omda XDS suite, where they have this product family, and they also list this Omda Plutus software. And looking into this, they mention IHE Aetna. So this is an IHE audit repository where you can store logs, and it meets that at IHE Aetna profile. And then, well, it's capable of, Aetna is based on syslog, so it's capable of ingesting syslog format information. And what you would use this for is to record events which occur in those other systems, logging the clinical actions and kind of who has viewed what content. Then we also have Omda Medimaker. So this is the product which came from Mavelle, but they don't really well, there's a lot of words, but kind of getting a grasp of what Medimaker is actually capable of is a bit hard here. A lot of buzzwords mentioned, so what kind of software it is, not that well described here. Then we have Omda Health Mail. This is some kind of secure messaging platform to send information across the network. Then we have Omda Sima, which is some kind of mobile visible light capture application, a mobile application, I would assume. I'm not familiar with this, and it's a bit hard to know based on the description here what are the actual capabilities of it. Then we have Omda Pixara, an end-to-end image management solution for real-time capture, storage, and archiving of non-radiological medical images. So I guess visible light images. And yeah, it kind of sounds and seems that Omda Pixara, Omda Sima, and Omda Medimaker are kind of in the same space, since this is visible light photography, but like how do they complement each other? And one kind of question one does get based on multiple acquisitions is that will they at some point merge some of these IPs? And like from an investor point of view, I would be thinking also about, well, do they have multiple R&D teams in different locations working on the different IPs, and which ones are the ones which they are actually investing on and further implementing new functionalities for. Then we have Omda Cardio, is the Electrocardiogram software. I don't think there's a screenshot of the actual user interface, but they do state that it's Class 2A medical device. This is according to the MDD, Medical Device Directive, and they don't mention the MDR here, so most likely it doesn't have the MDR certification yet. Looking a bit more about Omda's MDR situation, it seems that they have a press release where they say that Omda receives MDR certification, but the press release doesn't really state which products are covered under this MDR certification. Of course, one could do more research and check EudaMed, where you have listings of MDR certified products. So you might find more information there, but it might be that the web page is just not updated here, or then this electrocardiogram software does not yet have that certification. Not sure about that. In any case, a very interesting company with a very wide range of products, and seems to be growing strongly. So seems like the strategy which they have taken is working. If you found this information helpful or interesting, please give it a thumbs up, and please do comment down below if videos like this are interesting for you. Thanks for watching.